Hi, Ari Parker, Lead Medicare Advisor at Chapter. In this video, I'm going to discuss Medigap Plan G. What's Medigap? It's also known as Medicare Supplement. The terms are interchangeable. This type of plan sits on top of original Medicare and covers the gap, the 20% that you would otherwise owe out of pocket. So many like to describe it as the glue that holds Medicare together, because that way you don't end up with an infinite number of out-of-pocket costs. Let me give you an example of what I mean. My mom lives outside the Chicagoland area and needed a knee replacement. With her original Medicare, plus her Medigap Plan G, her knee replacement was fully covered. She could go to any doctor of choice. You can see any doctor. Your network is original Medicare's network. There's no network restriction. And you won't have out-of-pocket costs besides for the Part B annual deductible, which is quite low. It's only $226 for this year. So my mom was able to get great care. People who choose Medigap typically value peace of mind and flexibility over optimizing for the very lowest cost plan. Because Medigap will have a monthly charge, or a premium in other words, that you owe to the insurance carrier of your choosing. Now, the good news is that Plan G is standardized under federal law, and that goes for any Medicare Supplement plan letter type. These were all standardized by Congress in the 1980s. So any Plan G is going to work the same way nationwide, and that should give you a lot of peace of mind if you're traveling, if you're visiting your grandchildren, or if you own an RV. And just to give you an example of the features of a Plan G, there are 5. The first is that there's no copay when you go to the doctor. It's a $0 copay. The second is that you don't need referrals. You can go to any doctor of your choosing as long as they accept original Medicare, and almost every doctor and institution do, including the Mayo Clinic, the Cleveland Clinic, and MD Anderson. Another feature of Medigap is that your out-of-pocket cost is limited to the Part B annual deductible. So remember when I said my mom's knee replacement only cost $226? That was the Part B premium for 2023. And then 2 other features of Medigap Plan G is that excess charges are prohibited. What's an excess charge? It's when a doctor doesn't accept the Medicare assigned amount. If they don't, guess what? Your insurance carrier needs to eat it if you have a Plan G. And then finally, you get international coverage when you're abroad, when you're outside the United States, for the first 60 days of travel, up to a $50,000 lifetime limit. You might be wondering, all this sounds great. Ari, what's the cost? Well, the cost will vary based on where you live, even though it is standardized under federal law. There are 4 states that have year-round guaranteed issue, and they are all along the eastern seaboard. And those states, Medigap costs a lot more than in the 46 other states, where there's a window, a 6-month window, after you start Medicare Part B, where there are no questions that can be asked about your health history. If you miss that window, though, in those 46 states, then you would need to either use a guaranteed issue right in order to obtain a Medigap plan, or you would have to go through underwriting. That is, you'd have to answer questions about your health history. Now, if you're wondering what the price would be for Medigap Plan G where you live, my team has this at their fingertips. We have a platform that searches across every single option available to you, including the insurance carrier's creditworthiness, and also our 20-year sum of premium index, which is rolling forward your age 5, 10, 15, and 20 years to see what a carrier would charge based on today's rates. If you'd like to use that resource, feel free to visit us at askchapter.org.